focused on CureDuchenne LINK, which is our data integrated biobank. But before I go to that, I do want to let you know that when we were talking about the events the families do, I have an incredibly lucky streak going because I won 50 pounds of beef a couple years ago. It looked like a cadaver showing up at my house. And then I was trying to gift everybody beef for a long time, bartering with my hairdresser, et cetera. So you really do win. So I'm based in Raleigh, North Carolina, so it took a long time to get there. But this is actually the third Futures that I've had an opportunity to attend as part of the CureDuchenne LINK team. And what we've realized is we've explained to you over the last few years about CureDuchenne LINK and what it is, and I'll do a quick refresher. But the most important thing, I think, today is to have an opportunity to tell you about what we're doing with those data and samples. And we're going to get to those at the very last slide. It's always hard to be right before lunch. But CureDuchenne LINK, just as a reminder, is a data integrated biobank. And what that means is that we collect samples as well as data from people living with Duchenne, Becker, as well as carriers. We've heard a lot from our participants about making it even easier. So we've adjusted some things over the years. So we're actually just collecting your data and samples once a year, again, looking to reduce the burden. We look for anyone with these diagnoses. It doesn't have to be a specific mutation. It doesn't have to be a specific type of Duchenne. And we actually enroll from age 4 weeks to no upper limit. And really the purpose of why we started LINK was you as families get asked to provide data and samples probably at every turn, whether it's your providers, whether it's a company. And so Deborah had a vision. Why don't we just put it all in one place? Why don't we put it in a place that's not kind of tied to any one entity, so we can provide it out as needed upon request? It's like a site that gets up and running quickly in a clinical study. We need to move this along faster. So what we've realized is we're able to turn around and provide samples and data more quickly. So what does participation entail, just as a general reminder? So we actually have a table out there. You can find out more about LINK. You can actually enroll here. We're not collecting samples on site this year, but we ask you to collect. We're doing a survey. We're collecting blood samples, and then I'm going to talk a little bit more about our relationship with Picnic Health, who we use to collect and aggregate all of our medical records, or your medical records. So I think, as I mentioned, the real purpose is we know there's a lot of burden. You're caring for the disease, you're caring for your child, you're caring for your family. But on the flip side, we know that researchers can't move research forward more quickly unless they have the data and the samples in hand. So we get a lot of requests. You've had some companies up speaking already. We have more that are here. And they need this information quickly to make early decisions in their research. And we have that data and those samples available to support that. So this is just a little graphic to kind of show how important you as the family, you as the individual living with Duchenne, Becker, or a carrier, we know you're getting asked. And again, our goal is to put it all in one place, kind of a one-stop shop. So what we do, as I mentioned, is we're only sending researchers the data and samples that they need. We all know, we all have freezers. There's always something in the back of the freezer that you forgot about. Well, that happens with your samples too, because not all samples are used completely after they're collected. So what we do is when we work with our researchers, we provide them with exactly what they need. So what that means for you is that we may gather $1's worth of samples, but we're only giving the researchers the dimes that they need. So we can hang on to the rest of the dimes for when other researchers need that. And so by that, we've just basically established a hub for all of this. We work with our internal science teams to make sure we're partnering and approaching individuals and companies that may need our access to our samples. But I really wanted to get to, in kind of the last couple minutes before we introduce lunch, is to talk about the kind of what we've done to date. So we're really proud that we've been able to collaborate on 3 specific research programs with 3 biotechs and pharma companies that are actually here today. We can't talk a lot of details about what we did, but we were actually able to work with BioMarin, RegenXBio, and most recently Solid Biosciences to provide them with specific data and samples to help move some of their earlier phase research ahead. We have lots of other ongoing discussions with companies and with individual academic researchers to make our samples and data available to them. We've actually moved, and I know I'm not speaking in Spanish, but we've moved everything for LINK into Spanish as well. So what that means, and we talked about it last year, is that not only are the surveys and the information that's sent to you, but all of the help text, everything that you need to participate in LINK is completely in Spanish. And when we talk about our data collection partner for your medical data, we've actually been able to work with Picnic Health to move everything into Spanish there. So now the whole continuum is in Spanish. We talked last year about we had our first CureDuchenne LINK research site. We now have 10 of those across the country. And what those centers do, and we've got quite a few of them here at the conference, is they help identify individuals that might be interested in participating. Perhaps you're already going to the clinic, you're getting blood drawn. Well, isn't it much easier to just add a couple tubes while you're already being stuck that can be put aside for LINK? And these partners are helping us do that. They're helping explain the importance of something like LINK. You're not going to get an immediate result. There's not a cure that's going to come directly from that, but you're actually, supporting the earlier part of this research. So we're working with Trins, that's our CRO partner. They're well known in this space, so they help us manage these research sites. We're going to be looking to add more over time. But I think the most important thing everybody wants to know is, what does the data look like? Why haven't you published anything? We've done some awareness. So I'm excited to announce, it's the first time I think actually my team is seeing this, is we went and looked at what the data looks like in Picnic Health across the individuals that are enrolled. This actually is just focused specifically on our Duchenne guys right now. But just looking right now, this is just what from Picnic Health. It talks a lot about, and I think the far right-hand column about the data capture. We have about 7 years of data on each person enrolled in LINK. So that means that we've gone back in your medical records and they've been able to pull that, and then we're going to move forward as well. So what we're trying to do for a lot of individuals is get back to that time to diagnosis to find out, what it took to get to that junction. That we're looking and we're seeing that each individual in LINK has 23 different providers. If you think about that in paper terms, and we were kind of going through this about how many, bags you'd be carrying around if you had 23 providers' records all in one place. And that we know you're going to 6 different sites for care. Now that's big centers count as a site. Looking at what type of specialists that everybody is engaged with. It's great to see 91% are getting some sort or have gotten physical therapy. 97% have had an interaction with a cardiologist. Kind of unusual to only see 94% working with a neurologist. And then we just kind of looked at some more of the general kind of measurements that we would expect to see in individuals with Duchenne. We went across race, we looked at that as well. And again, these are just some kind of high-level variables. We do expect to do a large readout on our data a little bit later this year. And I think what, in sum is really what we wanted to share and shows that the power of you all contributing to LINK, the ongoing support of LINK, the fact that LINK is, is a living, breathing. So we've doubled enrollment since I started, and that's been amazing as well. We've added, as I mentioned, Spanish, so we're actually trying to reach a more broad population, and we'll continue to evaluate other languages as well. And certainly we welcome you if you have any specific questions, if you want to enroll, find out more about Picnic Health. They're sitting with us at our CureDuchenne LINK booth over there. But what we really want is just your commitment to help us spread the word, and again, to take any feedback that we have. So for those of you that are currently participating or have participated, thank you. That's my little warning. Thank you so much. It really means a lot to us. It means a lot to me and my team, Erica and Jamie, who you probably are interacting with. So thank you for that. And we look forward to next year and kind of continuing to support, and I hope our our research list is 3 times as long and that we have a lot more data to present. So I'm going to kind of wrap up here. I'm going to turn it over to Paul Miller, who's going to kind of close us out. But thank you, everyone, for your support, and go Link. So.
Thanks, Heather. All right, good stuff. All right, I'm back to being your Chief Custodial Officer, CSO. Grandparents, just a reminder, right over here, grab your lunch and meet here. And thank you for being here, grandparents. Do not forget to tell your story at the time capsule. Your story does matter. Let's memorialize it. And you'll be grateful for it to look back someday and think, man, look where we were and look where we are now. So please do that. It's very special. Exhibitor showcase is right next door. We're going to do that happy hour tonight and stuff. But if you got time today, go say hi. They got great stuff over there. And now I've taken on another title. As your Chief Fun Officer, CFO, I'm also the CFO as the Chief Foodie Officer. You ready for lunch? Lunch is right out the doors, right where breakfast was. You can grab food there, stay out there if you like the temperature. If you like to chill, you can be in here. So lunch, and we'll see you back here for this afternoon. There's breakout sessions. Find something that's meant for you. There's something for everybody in those breakout sessions. So thank you. See you soon.